Doctor, I'm a diabetic. What should I eat? Boy, I wish I had a nickel for every time somebody asked me that question. And it's a tough situation, and go over that with you and try and give you some answers that will be helpful and instructive to making these choices appropriately. Now, first of all, there's a really excellent resource that I want to guide you to, and it's called the Type 2 Diabetes Diet Book, written by Cal Ezrin and Robert Kowalski. Excellent book. The first half goes over how sugar is metabolized in your body, and the second half goes over good ideas for recipes and healthy eating ideas. And it can be effective for people with diabetes or who just want to lose weight to eat properly. Now, what's the goal in terms of eating for diabetes? And I see that there's two primary objectives. Number one is to keep the carbohydrate count down so your body can process the amount of carbs that come into your body. And number two is to keep the calories down so you either achieve your right weight or maintain your right weight. Both of them are important, and both of them have to be looked at when you're looking at a diabetic diet. Now, how do you estimate the calories that you need if you're either not trying to lose weight or you're at your right weight? And there's a couple of formulas that are helpful, but generally speaking, it'll be between 10 and 15 calories per pound is what you need to maintain your weight, unless you're pregnant or lactating, and then it's really 15 to 17 calories. But as you can imagine, if you're not very active or you're a little bit overweight, you probably should eat closer to 10 calories per pound. And if you're very active and fit, probably closer to 15. That's for the weight maintenance calorie prescription. If you're trying to lose weight, we prescribe differently if you're over 250 pounds or under 250 pounds. So if you're under 250 pounds, you should probably eat about 12 to 1500 calories per day, and probably you need to have about 40 to 50 grams fat per day. No more than that. Less if you can. If you're over 250 pounds, I'd rather see you eating between 15 to 1800 calories per day and about 50 to 60 grams, or less if you can, of fat per day. So those are some suggested calorie goals. Now let's talk about carbohydrate goals. And before we talk about that, I want to give you just some background material. How do you know if somebody's diabetic? Well, you check their blood sugar. And for years and years, the standard has been fasting blood sugar. So nothing to eat or drink for 8 hours. We check your blood sugar. If it's 126 or higher, you're diabetic. If it's 100 to 125, you're pre-diabetic or impaired fasting glucose or impaired glucose tolerance. Those are all terms that are bandied about that are pretty similar. And if it's 65 to 99, then your blood sugar is considered normal. Arguably, a more important number is what your sugar is 2 hours after a meal. And if it's over 140, you're considered diabetic, and really the lower the better in that situation. So how do you know how much carbohydrate to take in? Well, it really is well reflected on what your blood sugar is 2 hours after a meal and first thing in the morning. If your blood sugars are well under 140 2 hours after a meal, and you're about 80 to 120 first thing in the morning, you're probably eating an appropriate amount of carbohydrate. But here's a kind of a good way, kind of a rule of thumb to put that. If you're eating 3 meals a day plus 1 or 2 snacks, you want to keep, in a situation where you're not trying to lose weight, you want to keep your total carbs to about 130 grams per day. And that equates to 3 meals of 30 to 40, some say 45, I say 40 grams of carb per meal, and 10 to 15 grams per snack. And if you're trying to lose weight, I say be a little more aggressive and try and keep your carbs to 100 grams per day. So 3 meals of 30 grams per meal, and then 1 snack of 10. Now, carbs, what are we talking about when we're talking about carbs? We're talking about sugar and starch. And so sugars are things like milk sugars, lactose, which is milk, cheese, yogurt, and ice cream. Of course, table sugar that we add to coffee and tea. Baked goods like cookies, candies, donuts, and desserts. The sugar in soda, not diet soda, but regular soda, which has a lot of sugar, and fruits and fruit juices. And sugars differ from starches in that a sugar is an individual 6-carbon chain, and starches are long long chains of these individual cis-carbon chains. And so starches take longer to break down because you have to break down the chains of sugar molecules, and so it absorbs more slowly into your bloodstream. Starches are bread, rice, potato, pasta, and starchy vegetables like corn and carrots. And so anyway, that's where it comes from, and those are some kind of ballpark figures on where you need to be in terms of your carbohydrate and calorie intake as a diabetic. Most importantly, see your doctor every 3 months for a check of your hemoglobin A1C and your sugar and a lot of other things as a diabetic. It's well worth it to keep you healthy. Hope that helps, and I'll talk to you later.